Assalamu alaikum and welcome to this week's Journal Club, where I'll be talking about a paper published in 2020 in the JOE by Jang and others. The paper was titled Clinical Factors Associated with Apical Periodontitis Visible on Cone Beam Computed Tomography but Missed with Periapical Radiographs, a retrospective clinical study. So starting off with the objectives, the study aimed to identify preoperative predictors, including patient and tooth-related factors, and correlated that with the presence of apical periodontitis visible only in CBCT images. The study also sought to investigate the characteristics of apical periodontitis visible only in CBCT images and compared that with apical periodontitis visible on both PA radiographs and CBCT images. For the study design, it was a retrospective clinical study, and for the sample size, the study enrolled 332 consecutive patients with both PA radiographs and CBCT images, and a total of 203 teeth were included in the analysis. Now, moving on to the methodology, periapical lesions were assessed using a modified CBCT PA index by two endodontists, and they recorded patient-related factors and tooth-related factors. For the patient-related factors, it was age, sex, and symptoms, and tooth-related factors included tooth type, location, pulp status, and pulpal diagnosis. And these were assessed to determine their relationships with the presence of apical periodontitis visible only in CBCT images. Moving on to the results, they first found that apical periodontitis was detected in 24% and 35% of untreated teeth by PA radiographs and CBCT images respectively, and pulp necrosis was significantly correlated with the presence of apical periodontitis visible only in CBCT images. And for the most important finding, they found that lesion sizes smaller than 2 millimeters in diameter and the involvement of molars were significant factors of lesions visible only in CBCT images. And finally, moving on to the conclusion, the first one is pulp necrosis was a preoperative predictor of apical periodontitis visible only in CBCT images, and that this research could provide a proper indication for CBCT imaging at diagnostic stages, and this study highlights the importance of CBCT imaging prior to treating our patients. Thank you very much.